All right, welcome everyone. Today we are looking at chapter 7, which is the skeletal system. So let's take a look at our study guide. As it says here, we're going to talk about the structure of your typical bone. Okay? So these are the words we are going to be referring to, and I'm going to be drawing it right here on the board. All right? So let's get started. This is a typical long bone. Okay. We call it a long bone because it's what? Longer than it is wide. Okay. First word is epiphysis. That's this. The ends of the long bone. What does epi mean? On the top. Okay. Epiphysis. Okay. Epiphysis. 10-4. All right. Don't we have two ends on this long bone? Well, which epiphysis is what? How can you tell them apart? Well, long bones are your arms and your legs. Well, what end is this? Proximal. What end is this? Distal. So this would be the proximal end, closer to the body, whether that's your arm or your leg. And this would be the distal. Make sense? All right. Next thing on the board, it says articular cartilage. Well, where does a long bone articulate? Where does it move? If we're going to look here, it moves here and it moves here. So the ends of the long bones are where we articulate. And on the top of every long bone is hyaline cartilage. And you might say to yourself, what you talking about? Hyaline, I don't know if you can see this. Hyaline cartilage. I'll just say cartilage. Hyaline cartilage is the most common cartilage, and if you've ever eaten a chicken leg, it's the crunchy parts on the ends that people don't eat. Okay? So, because that chicken is a leg, right, that you're eating, or a chicken wing, they got cartilage on the ends there too. Fair enough? Mm-hmm. All right. If the two ends are called the epiphysis, guess what the middle is called? The middle is called the diaphysis. That's an S. Diaphysis. Now, don't freak out. It's not di as in two, it's dia. And if you remember, we talked earlier, dia means freely. Okay? So be careful. So this is the free end. It doesn't have, an end that ends. Got it? Okay. So that's a diaphysis. The next thing you see on your list is epiphyseal plate. What's that? Here. The epiphyseal plate is also known as the growth plate. This is where we grow, okay? Because your bone is growing this way and this way. And right at that edge here is more cartilage. Okay? And this is also known as the growth plate. So, what is happening to us when we are children? The cartilage is becoming bone, okay? Which makes your limbs get longer. What happens when we stop growing? Now, instead of cartilage at this growth plate, it becomes solid bone and no more growth. So around puberty, when you hit your growth spurt, after the growth spurt is done, it solidifies. And when it solidifies, we call this a synostosis. What's osteo? Bone. What's syn? Together. So the two bones fuse and no more growth. Okay? Synostosis. Cool beans? Mm-hmm. All right. Next, periosteum. What is peri? We've talked about peri before. Like the perimeter around your yard, right? The outer edge, okay? We talked about the pericardium, the sac around the heart. Well, this is around the osteum, around the bone. And what we have around the bone is a type of connective tissue that covers, now of course, all the way around your bone. That's your periosteum. And then we have compact and spongy bone. Compact bone is this part of the bone to the outside. That's your compact, and that's where the bone is hard. What about in here? And what about in here? In here you have your spongy bone. This is not solid here. It's actually full of holes. And each of these lines that I'm drawing is called trabeculae. Okay? And those are, the word trabeculae means beams. Look at my fingers. If I go like this, don't I have hollow spaces in between my fingers? But my fingers are solid. Got it? But the whole area is solid. So what's in between those trabeculae? Your bone marrow. This is where the red and white blood cells are born. Okay? Now we still have trabeculae here, but not here. This is hollow. And the hollow cavity is called the medullary cavity. Yeah, let's see if we can look at the words here. See, we have our compact to the outside, we have our spongy on the ends, and we have trabeculae that makes the spongy bone. And then there's a medullary cavity in the center of the hollow shaft of the bone, in the diaphysis. And what happens to be on the inside of the diaphysis? Adipose tissue. Yes, this is where animals store fat. Okay? If they don't have it here, they store it in the center of their long bones. And you might have a grandma who used to cook with bone marrow. They would buy, they would go to the butcher, get some meat, and then they would say, hey, do you have any long bones laying around? Don't throw them away. Because you would have a long bone, if you cut it open, it looks like this. That's your compact bone, all the way around. You've got a couple of trabeculae here, because that's always long bone and compact bone, as our compact and spongy bone. But right smack in the middle here is a nice juicy part that is fatty. You take that, put it in the soup pot. Out comes the fat. You throw away the bone, but it provides the flavor. And that's why animals in the wild eat the bones of the other animal, is to get to the fat. Because remember, how many calories in lipids? 9. But in meat, 4, and in carbs, 4. So you get more bang for your buck right here. We eat it because it tastes good. Okay? All right. Cool beans? How's that going? Doing good? Okay. All right. The next thing is, what are the functions of bone? Number 1, support. Could I stand here if I had no bones in my legs? That's support. Could you sit in your chair if you didn't have bones in your back? That's support. Protection. That makes sense. Your skull protects your brain. Your brain is literally the consistency of a bowl of oatmeal. So your brain on the outside of your body wouldn't stand a chance, all right, of survival. Your ribs protect your lungs and your heart, okay? And of course, movement. You could not walk if you didn't have bones in your legs. You could not reach out if you didn't have bones that the muscles pull on to be able to grasp and stuff like that. Okay? So don't forget, that's the function of your bones. All right? Now, how about this one? How do bones grow? Intramembranous and endochondrial. All right? Let's walk over here. Okay, let's look at these words. Intra and endo. What does intra mean?
Inside?
Inside or within. Got it? What's endo mean? Inside or within.
Okay. See, I was confused because I thought it was the same.
Yeah. But we do this on purpose. If you mean the same thing, why don't you call them both endo? Because we want to make sure you understand they're two totally different endos. There's two totally different things happening on the inside. Okay? And the key is understanding the second part of the word. Intramembranous is inside a membrane of collagen fibers. Remember those tough collagen fibers that make up, the thickness of your skin and the hardness and stuff like that, and the ability to hold together. So, your bones start as collagen fibers in many cases. Gee, what's the second half of the endo word? Chondrial growth. Well, what's chondro? Cartilage. So guess what? That means some of your bones start within cartilage. You have a cartilaginous skeleton as a baby, which then becomes bone. And it slowly ossifies, and that's how you can tell how old a fetus is when you look at it. What part of the bone is already calcium deposits, and which part is still hyaline cartilage. Okay? And here's the hint. The long bones are the ones that start. And that's what your test question is going to be. So make sure you got that under control. I'll make it nice and red so you can see it. Who starts and grows this way? It's your long bones. Okay? That means arms, legs, fingers, toes. All right? Who grows this way? Everyone else. Okay? Oops, I can't spell. Everyone else. And, as you said, who are the others? Short bones, which are the ones in your wrists and in your ankles, because they are as tall as they are wide. What else? Flat bones. The flat bones, like your sternum, like your forehead, like the parietal bones. Okay? So your skull is mostly flat bones, your jaw is flat bones. And the ones that defy description, those are your irregular bones. And the irregular bones, is that got two words or one? I think it's one. No,
it looks right.
Two.
It looks right. Yeah.
Okay. For example, your pelvis, that's very irregular. Your scapula, your vertebra have a weird shape. Got it? And we saw those in lab today. But all of these guys start as this. Okay? Now, here is a typical Mr. Weber thinking question. Alrighty? You've heard of dwarfism. Okay? Who's that guy who's the actor?
I'm terrible with names.
I am too. You know who he is. He's the guy from that Game of Thrones, the short guy. Okay. Somebody's going to look that up. Peter Dinklage. Yeah. That's right. Peter Dinklage. Okay, if you need to know who that is, you can always look it up. He looks like he's got a big head, but it's the normal shaped head and a normal shaped torso, but all his arms and legs and fingers and toes are extra short. What's the name of his genetic condition?
Achondroplasia.
Achondroplasia. So let's dissect this word. What's a chondro? Cartilage. Plasia. Growth. A in front of any word? Not. So the cartilage did not grow. So if his cartilage can't grow long, then can his arm bones grow long? No, because the cartilage gets turned into bone. And how do we know that? What's the remnant on the two ends of the epiphysis? Cartilage. See, it started as cartilage in the middle, and then it becomes just the cartilage remnant on the two ends. Okay? All right. We doing good? I want to make sure you understand what a flat bone and a short bone and an irregular bone would look like. They're basically like a sandwich. Okay? The outside of the bone, flat bone, is compact bone. Compact. And the inside is where we have our trabeculae and the bone marrow. See? Now in 210, you're going to hear that this is called diploe. I'm not going to worry about, messing you up with that now. But it's here on the inside. Okay? It's sandwiched in between. It is not hollow like a shaft is hollow with fat in it. Okay? That's another way you can always tell a long bone from a flat bone. In fact, our clavicles are flat bones. Our ribs are classified as flat bones because they're not hollow. Oh, they're kind of long. Yeah, but they're long and flat. This is flattened this way, and these guys are flattened this way. Okay? We saw those in the lab today. Alrighty? Cool beans? So, that's what we're talking about. So, look over here. Possible test questions. Sorry for constantly going back and forth. Oops. Possible test questions. Hey, your femur started as A or B?
Endochondrial.
Endochondrial growth, Your frontal bone began as, or began using what growth?
Intramembranous growth.
Yeah. Where would you go if you were going to donate your bone marrow to a loved one who needed bone marrow transplant due to cancer?
Like what bone?
Yeah, where would you get it from?
Your arm or your leg?
No. Here's the reason why. There's your arm and leg, right? Where's all the bone marrow? In the most important part, the ball going into your socket, or the ball going into your socket. Do you want to drill holes in that and make it weak?
No.
That will make it break easier, especially your hip. So guess what? We don't get it out of the epiphysis of our long bones. We drill a hole in the sternum to get the bone marrow out. Would you drill a hole in somebody's head? No. So we're not going to get it out of these flat bones, but this flat bone and the coxal ridge of your pelvis. They drill holes in that. Okay? So if you're donating, it's painful because they're drilling holes in your bone. What if you receive the bone marrow? Do they drill a hole in here and put it in there? No. They used to. Now they realize you just inject it into the patient, it'll find its way inside the bone. Those marrow cells will find their way inside the epiphysis or inside the flat bones. Isn't that cool? All right. So, while we're talking about growth, let's talk about these. I'm just going to make it flip so it doesn't bug out. Osteoblasts and osteoclasts. Of course, we all agree osteo means bone. Blasts do what?
Build.
So clasts do what?
Destroy or break down.
Break down, exactly. So, possible test questions. Here we go. You are 2 years old. Which one of these two is working overtime?
Osteoblast.
The blast, because you're trying to build. Got it? Oh, I'm 80 years old. I ain't growing no more, so who's working more abundantly?
Osteoclast.
Exactly. That's why grandma has that hunched back and she has osteoporosis because her osteos are getting porous. 10-4. Anybody know why grandma has osteoporosis but you don't?
Not eating enough calcium?
Yes. You need calcium in your blood because, and I'll say the cause in a second, but if you don't eat it every day, you're going to poop it out. Okay? So why do I need calcium in my blood? 5 reasons.
Heart? Make your
Number
heart
1, it's the main depolarizer to make your heart beat. So what do you want to have? A good looking skeleton and a dead heart? No. Number 2, it makes your nerves work, including your brain. If your brain can't work, that's not going to help, is it? Okay. What else?
Muscles?
Makes your muscles contract. All right? Without calcium, free calcium, you can't contract your muscles. Number 4.
Help me out.
Blood clotting.
Oh, okay.
Every step of blood clotting requires free calcium in the blood. So, do you want to, have a stopped heart? Do you want to have a stopped brain? Do you want to bleed to death? See, the idea is as long as your brain is working, your heart is working, and your muscles are working, go to the store and get some calcium. If you're an animal, go kill somebody, eat their bones.
Mm-hmm.
Alrighty? And the last one is mitosis. Can't do mitosis without free calcium. Alright? So, kind of important. So, what I'm saying is you don't need free calcium in your blood to make your bones strong. Because obviously, we're going to dig the calcium out of your bones to keep calcium in your blood. So it's kind of counterintuitive. Why would you take it out of your bones to put it back into your bones? Okay? So be careful. Don't choose that answer. See how we got test questions? That's what we're talking about, because Mr. Weber's going to put that on his test. Okay, fractures. Green stick, the hairline fracture, little fracture, comminuted. Now look at this one. We cover this up. What word do you see?
Minute?
Yeah, first minute, which is a small amount of time, but minute is what we're really looking for. That means this has lots of little pieces that are broken. Transverse, okay, oblique, spiral, and simple versus compound. So let's take a look here. Let me move this so I can get it. I'll be right there. This is a Word document, not a PowerPoint, so. Is that too big? Yeah, let me see. How do I get this thing smaller? Well, I guess it's good enough. We can see all this now. Yeah, we can see this. Okay, ready?
Mm-hmm.
Okay. The first word up there was green stick. Is this break all the way through? No. Just like if you had a dry stick and you went like this, snap, 2 pieces. But if it's still alive, if it's green, you can bend it some. The top might break, but the whole thing doesn't break apart. See, that's not all the way through. Who would have a green stick fracture?
A younger person.
A younger person, because you still have collagen fibers in there, making it strong enough that it doesn't break all the way through. Not grandma. Grandma's going to be a complete break. All right? This break is complete, but it's across the linear side, so that's a transverse break. Okay? If the break was like this, that's a linear break. This is comminuted. See all the little pieces? This bone got shattered. Now, can you just put a cast on this? No, there's no way. You've got to make sure these pieces come back together again. So something like this has to be plated and screwed together to make sure all the pieces are in the right place. So there's a plate here and a plate here with a bunch of screws keeping it together, and then you put a cast on it. Okay? This is a spiral fracture, meaning it starts here and comes around to the other side. That's a common sports injury. For example, you're running with the ball, you've just planted your foot in the field, and somebody hits you and spins you around. Your tibia could twist and break. Now, you got a 5-year-old patient with a spiral fracture of the arm, that might be child abuse. where somebody grabbed the kid's arm and wrenched it like this. Well, your bones aren't meant to go like that. You get a spiral fracture, okay? So, as a healthcare provider, you have to be cognizant of that, all right? And this is a oblique fracture because it's coming at an angle, but also, see how the bone is sticking out? That has now turned a simple fracture into a compound fracture. A simple fracture, the bone is inside the skin, so all we have to do is set it and brace it, and put your cast on it. You can't slap a cast on this. Your skin is broken. Blood's coming out, bacteria are coming in. So this, you've got to open this up, put that back in, probably plate it and screw it again, but now you have to make sure you don't get any infection before you put a cast around it, or you're just asking for trouble. Does that make sense? Okay. Where's my clicker? Let me go back. Yeah, see? So a green stick halfway, a hairline fracture, just a little bit of a fracture, comminuted, lots of little pieces, transverse, oblique at an angle, the spiral, and simple means it's not sticking out of the bone, out of the skin. Compound. You've compounded the problem. It's a lot worse than just a broken bone. Everybody cool? All right. And let's see. Let's do this one. This is pretty easy. 1, 2, 3, 4. The 4 steps of healing a bone. Let's walk over here. I'm going to use my longbow that we already have. Uh-oh. My bone done broke. Broken here and here, right? Okay. By the way, this is a displaced break. I can't just splint this and put a cast on it. I've got to put it back together again. Just like if it's broken like this, I got to put it back together again. All right? That's a displaced, fracture. All right. The first thing that happens, and has anybody ever had a broken bone? Okay.
I've never.
I did. Fell down the stairs and snap. Okay, my foot. The first thing you see is a bunch of blood under the skin. Okay, and because these blood vessels, there's blood vessels in here, they've broken. And so you get a big blood blister under your skin, which eventually turns black, blue and black, we call it bruise. And so the first step is a hematoma, a blood blister. So your ankle or arm, whatever, swells up and eventually turns blue, because that's all the broken blood vessels turning into a big old bruise, okay? Should you be walking on this leg? No, not at all, okay? And that's why you have nociceptors, pain receptors telling you, hey, this hurts, get something done about it, okay? All right. Number 2, we get what's called a soft callus. Your macrophages come in here and start cleaning this up a little bit, get rid of the dried blood and all. And what do we start building? We start building some fibrocartilage. Okay? And so we call this a soft callus. Why? Because you can poke it. Okay? But it is made of what? Fibrocartilage. Fibrocartilage. Okay? Fibrocartilage. Gee, can you stand on that yet? No. This is why you stay off your leg or don't use your arm for 6 to 8 weeks. 10-4, you got to get the bone to grow back. Cool beans? Well, guess what the next step is? The next step, we call that a hard callus. Hard callus. And gee, the hard callus is no longer fibrocartilage. What is it? It's a bunch of trabeculae. Trabeculae. And what does that mean? Instead of cartilage here, we're starting to put those little beams made of bone. Those little beams made of bone. Can you walk on that yet? No, because it's just a network of bone. That's going to collapse when you put any pressure on it. Okay? That's why you stay off your leg for a while. Got it? Okay. And once this does become solid bone, and it finishes healing, it'll look more like this. Here is your hard bone, your compact bone, but your compact bone looks like this because it followed the healing pattern of the hematoma and the soft callus and the hard callus. Alrighty? Now, is that normal to have that bulge? And you'll see this bulge for several years. That's the way you can tell of child abuse, because you say, oh, the child came in for this broken bone, but you see on the x-ray old breaks in other places. Got it? Because it doesn't all go down right away. So, is this going to stay like this forever? No. Guess what we're going to do? We are going to eventually get the bone the way it's supposed to be. Now, how are we going to do that? Well, on this side, we cut away the bone using osteoclast.
Yeah.
And on this side, we lay more bone.
Osteoblast.
Yeah, until the whole thing moves over and is back to where it's supposed to be. And it happens slowly over years. Okay? Now, we call it bone remodeling. Remodeling, as an E, because it's like remodeling your kitchen. When you remodel your kitchen, do you gut the whole house or just the kitchen?
Just the kitchen.
You don't redo the whole bone, just the place that needs it. And you always do it with class digging on one side and blast building on the other side. And that's how it moves over. Everybody with me? All right. That's why we, used all that stuff. Cool beans? All right. We're almost done, folks. We're almost done. Now, which bones do you need to know? That's on your lab list. And we did that in lab today. Okay, the next thing are your different types of joints. What's a joint? A joint is where two bones come together. Okay? Well, your joints are called fibrous, cartilaginous, or synovial on purpose. G, the fibrous ones are made of collagen fibers. The cartilaginous ones are made of cartilage, hyaline cartilage or fibrocartilage. And the synovials are hollow with synovial fluid. What are we talking about? Well, number one, the sutures of your skull. When your skull is apart, it's when you're a baby. Baby skull bones are not fused together yet. Why?
Because the bones haven't ossified.
But why don't you want them to ossify? Two reasons. You might have to deform the head of the baby to come out of the birth canal. And is your brain still this size?
No.
No. So we need to have room to grow. So your bones haven't joined together yet. Okay? Now what do I call two bones fused together? Synostosis. So it's still open. But it's not open like wide open like an open door. Guess what's holding them together?
Collagen fibers.
Collagen fibers. Okay? And that's the sutures of your skull. Got it? After puberty, we start turning the collagen fibers into bone, and then somewhere in the 20s or 30s, that's when your skull suddenly fuses all of them together. And we call them sutures because they kind of zigzag along your skull, like we saw in the lab today. They zigzag through the skull, and it looks like somebody sewed it together. That's why it's called a suture, like a suture that somebody would put on you after an operation. Alrighty? Now, we classify these sutures that cannot move anymore, your brain, your skull being able to, no. We call that arthro joint together. Got it? These joints don't move. Everybody with me? Once they've solidified, they're not going to move anymore. Oh, what do I call that open joint for the baby, like on top of their head, the soft spot? Fontanelle. That's the fontanelle. Okay. How about these? The cartilaginous ones. Well, that's cartilage between bones, like we find in the discs between our vertebra and the pubic symphysis between the two pelvic bones in the front. Now they can move a little bit, can't they? So it's called amphiarthrosis. Now again, arthro means a joint. When I have arthritis, I can't move my joint. Got it? Itis, inflammation of the joints. It's not inflammation of this, it's inflammation of the joints. Okay? Where have we seen the word amphi before?
Ambidextrous.
Ambidextrous. It's amphi.
Amphibian.
Amphibian. And what's so special about them? They live half their life in the water and half their life out of the water. So they're a little bit of both. Got it? And that's what they're saying here. A little bit of movement. Got it? Some movement. Okay. I mean, the pubic symphysis can move on a girl to open up her pelvis to let the baby through. Not on a guy. There's no movement there at all. Okay? All right. And then this is most joints we've ever heard of. The joints that move, your elbows, your arms, your legs, your knee, your ankle. Got it? Your fingers. And, oh, there's that dia word. A joint that is freely moving. Freely moving. Alrighty? And that's exactly what we're doing. So let's take a look. I think I got some pictures here real quick. Alright. Give me a second, let me move it up a little bit. Oh my goodness, there are 206 bones in the human body. Don't forget, you don't have to worry about learning them all. Half of them are on the same thing on the other sides. Got it? Okay. Now, let's take a look. Fibrous joint. A joint that's not supposed to really move. And that would be your sutures, but also this, the joint that holds your teeth in place. Those are collagen fibers here. Okay? And when you get a cavity, or you have gingivitis, the bacteria are here and they reach down in here and they loosen up this joint and your teeth fall out. Okay, so floss and brush. Okay, got it? Next, cartilaginous. Well, here are your ribs. Your ribs are bone, your sternum is bone, but are the ribs attached directly to your sternum? Bone to bone? No. There's cartilage in between. And can this cartilage move? Yeah, otherwise you couldn't breathe. So, cartilage between the bones, and it happens to be, some fibrocartilage. This has to be hyaline. In between your vertebra, it's fibrocartilage, all right? But it's still cartilage. And this is synovial joint, like the ball and socket, where your humerus is attached to your scapula. Believe it or not, the ball is not even touching the socket. There's a gap here, full of fluid, okay? And that's why we can articulate it so well. In fact, let's walk over here, and I'm going to show you what that looks like. I'll use my same buddy over here. So, let's say we're trying to see how does this bone get together with this bone here, okay? How are we going to articulate this? All right, well, first of all, this one's going to have cartilage on the outside, on the edge. That's long bone here, long, like your finger bones or something like that, okay? Okay. What else do we have? Well, we have basically, it's a membrane, and that membrane contains synovial fluid, so that, does this bone actually touch this bone? No. And there's a bulge here that holds the fluid. But that's not the end of it, because on the outside we have ligaments to hold it together, all right? And that's what allows these joints to move freely. Now, have you heard of somebody with arthritis? Okay. Under normal wear and tear, we call it osteoarthritis. What happens is the fluid dries up. As we get older, the fluid in here dries up. If the fluid in here dries up, guess what? The cartilage starts grinding on the cartilage. How do you think that feels? Not so good. That's part of the pain, okay? Guess what happens when the cartilage is worn off? Now it's bone on bone grinding. How do you think that feels? Really bad. And that's why when that happens in your knee, for example, you might be needing a knee replacement, where they basically cut this part, and have an artificial thing in between that can articulate. Or a hip replacement, where they replace the ball and they actually replace the socket. The ball is now a metal shaft with a Teflon ball on it, and your acetabulum, which is your joint here, the part that the socket goes into, they cut that whole bone out and put in a metal basket with Teflon on the inside. And now it'll go like this. No need to put fluid because it's just Teflon on Teflon. Okay? So that's what's going on. Make sense? So, all right. Is there anything else? Where's my clicker? There it is. Okay, we'll talk about that in class better, or in lab better. This is the last thing, okay? How are we going to move these joints? All right? Flexion, make the angle smaller. Extension, make the angle bigger. So I can flex my arm, or I can flex my wrist, okay? Now, dorsiflexion and plantar flexion are your foot. So, what side of your foot is dorsal? I'm going to have to lean up. I'm too old for this, okay? If I flex my foot like this, up, that's dorsiflexion. If I flex my foot down, point my toes down, that's plantar flexion, because the bottom of the foot, remember, is the plantar region. All right? Okay, abduction and adduction. A lot of students get this backwards. Here is what I think would be a good thing to put on your flashcard. Abduct. When somebody abducts your child, are they bringing them home or stealing them away?
Taking them away.
So on a card, I would put abduct or abduction is moving your arms away from the body. You can do the same thing. You can move your leg away from the midline. That's abduction. Well, what's the opposite? Adduction. Bring your arms back. Bring your legs back. Okay? So, when we get to the muscle chapter, see the thumb here? What muscle makes my thumb do this? Adductor. Yeah. What muscle pulls my thumb away? The abductor. Your thumb is called the pollicis. So adductor and abductor, pollicis. All right? To bring your legs together, what muscles are on the inside of your thighs? Adductors or abductors?
Adductors.
Adductor, yeah. Adductor magnus. Got to pull your legs together. Does that make sense?
Mm-hmm.
Okay. Now, what does circ look like?
Circle.
Circle. So when you make a circle with your arms, that's called circumduction. You can do it with your leg as well. Got it? How come you can do that? Because you have a ball and socket that can rotate. All right? That's circumduction. And last but not least is pronation and supination. All right? And just to give you an idea, you're watching your CSI show, and the body was found in a prone position. Prone position. Or the body was found in a supine position. Well, I can do the same thing with my arms. This is prone. This is supine. Got it? Prone, palms down. Got it? Prone, face down. Supine, face up. Supine, palms up. Here is how my students tell me they remember it. How do you carry a bowl of soup? With your palms up. You don't carry a bowl of soup like this. That's supine. Okay? Now, this may sound kind of weird, but in the muscle chapter, what muscle is going to make my arm do this? Pronator. Who's going to make my arm do this? Supinator. Who is going to make my wrist do this? Flexor. Who's going to make my wrist do this? Extensor. So my flexors are here, and my extensors are here. Got it? And, you got your pronator this way, pulling it over, and you got your supinator going in the opposite direction, pulling it that way. Okay? So a lot of muscles are named for what they do for a living, which makes it easier to understand where they would be. Okay? And that's the end of it. How about that? Pretty cool.